Hello everybody, Dr. Chris are back with you for Contact Tracer Training, Unit 1, Part 2. We're going to look at some concepts involved in concept training, looking at cases, contacts, isolation, and quarantine. A case is somebody who has the COVID-19. Or if you're doing contact tracing for anything else, it could be measles, it could be whatever. But we refer to a case as someone who is infected, usually has already had a positive lab test. Or we could talk about a probable case of someone who has symptoms but hasn't been tested yet. And then we could talk about contacts. Contacts are people who had contact with a case while they were infectious, either during their illness or 2 days before their illness began. Because remember, somebody can be infectious 2 days before they develop symptoms. Now keep in mind there are three kinds of contact: physical contact, handshake, a hug, or a close contact where you're within 6 feet of somebody for a long period of time after, say, 15 minutes. Maybe you're having dinner with somebody, for example. Or you're in the same room with somebody, maybe more than 6 feet away, but for an extended period of time inside. Now, the concepts of isolation and quarantine. Isolation is for sick people. Quarantine are for people who have been exposed to sick people. Isolation keeps sick people separate from healthy people. People are restricted to their home or a hotel, or if they have to go to the hospital, in the cases of COVID, people in hospitals with COVID are isolated from people without COVID. And people need to be isolated when they're sick for the duration of their infectiousness, hopefully 2 days before they develop any symptoms, and then at least 10 days after any symptoms develop. And they've had no fever within the last 3 days. Now, quarantine are for people who have been exposed but have yet to develop any kind of symptoms. People who have been exposed to others need to quarantine for at least 14 days since the last time they had contact with a person who was infected. We're talking 2 weeks. Very important. So, how long should somebody infected be isolated from others? Well, as long as they're infectious, until they fully recover. By the time they get diagnosed, they're sick already. And so they must monitor their symptoms. And once they no longer have symptoms, they're no longer infectious. But they need to be isolated for at least 10 days after symptoms onset, as long as these symptoms are resolved. Let's assume that you call a case on May 10th, and they tell you that they became ill on the 9th. Now, let's assume that they fully recover by May 19th. So you know that, let's say you talk to them on the 10th, you're going to ask them, who were their contacts from May 7th to May 10th? So a contact needs to be in quarantine for at least 14 days after they've been exposed to somebody with an infection. And this is the case, if they start to develop symptoms, they're no longer contacts. Then we're dealing with a case. So, if you call them on the 13th and you understand their last contact was the case was on the 10th, then you need to instruct them, encourage them to quarantine for 14 days since that last exposure. In other words, until the 24th. But keep in mind, if they live with this person, they need to quarantine for 14 days after this person that they live with a case no longer has symptoms. So this delays their quarantine a lot longer. So if you call them on the 10th, somebody on the 10th, and they became ill on the 9th, you know they were infectious since the 7th. They'll be infectious for at least 10 days after the onset. So May 19th. And so the case is going to need ongoing follow-up. So you can, let them know when it's good, that when they can stop isolating from others. The contact of this person must, if they live with them, must quarantine for 14 days 14 days after that case recovers. So that makes that is quite a burden on people that live with the case. And so, in other words, if we call the case on the 13th and a person they live with became ill on the 9th, then they would have to assume that case will be full. Let's say that case recovers by May 19th in 10 days. Then that contact that lives with them would still have to maintain quarantine for 14 more days until June 2nd. As you become more familiar with how to do contact tracing and how to specifically deal with this COVID-19 virus, this will become common sense to you, and we will go further into it as this course continues. I'm Dr. K. I will be back with you again for Unit 1, Part 3. Bye.